medical services.
Can we skip the funding?
Yep, and so just again added some findings and purpose statement. With some technical changes from the EMS special fund and some additional changes around the prioritization of the use of the funds as providing grants to programs offering basic emergency medical services training at low or no cost to participants. So trying to get more people into the emergency medical services field. And also to make reasonable efforts to award grants in a geographically equitable manner among all the EMS districts and trying to help districts get grants who may have had issues getting in the past. Sections 3 and 4 deal with reimbursement for emergency medical services, specifically the treatment without transport, and increasing the Medicaid reimbursement rate to be the Medicare basic life support rate. And then also having AHS report as part of its annual budget presentation what it would cost to take all emergency medical services delivered by EMS providers up to the Medicare basic life support rate. So that's 3 and 4. Section 5 is the EMS advisory committee. Makes some cleanup changes. In the first part, specifies that the Agency of Human Services provides assistance to the EMS advisory committee, and then it kind of overhauls the reporting requirement to get rid of the current reporting requirement, which has had the same information reported for a number of years, and replace it with the EMS advisory committee developing and maintaining an ongoing 5-year statewide plan for coordinated delivery of EMS services, and specifies that must be updated at least annually and include certain items and be delivered to the General Assembly and Health Department annually by December 15th. Reviewing progress toward achieving the goals. Section 6 is the EMS Advisory Committee statewide EMS system design. This is the one that has 2 pieces, so it's still the same EMS Advisory Committee. The first part of their work would be to collect the data necessary to conduct a complete inventory and assessment of all EMS services currently available in Vermont, including personnel, spending, gaps and overlaps in services. And that piece of it will be reported, skip to the end here for a second, in December of 2025. The second piece of it, which will be a year longer, is providing recommendations for the design of a statewide EMS system. And a number of specified items to be recommended on there. Stakeholders, and this part of the money request here is to be able to hire a project manager and other consultants who are subject matter experts and help the committee with its work, and directing the health department to support it. And then that second report with the design recommendations for the coordinated statewide EMS system are due in December of 2026. Section 7 increases the amount of funding going into the fire safety special fund, and this is the one that is paid for by property and casualty insurance companies. Currently raises 1.2 million, of which 150,000 goes to the EMS special fund. This would increase that by 300,000 to 1.5 million. And increase the amount that specifically goes to the EMS special fund up to 450,000. So it increases it by 300,000 and puts that full 300,000 into the EMS special fund. Then we get into appropriations. Section 8 is 74,000 in global commitment fund. So that's the gross amount for the Medicaid treatment without transport. And breaks out the 2 pieces of that in the general fund and the federal funds. Section 9 is the funding for the EMS advisory committee, and that directs 150,000 from the EMS special fund to support the EMS advisory committee in doing that multi-year work they're directed to do with those 2 reports. And if there is additional money available, unobligated funds in the EMS special fund in FY25, then up to an additional 220,000 would be appropriated and made available to the department to support that work.
So can you go back up just here? The 150,000, that's really for the program manager to facilitate.
It's for the contractor, it's for the, it's potentially for that, that project manager and additional consultants. That I think is the majority of what the financial need would be, but other needs they may have related as well.
Well, I think one of the key places for me is the payment of services without transport.
Right, so that's a separate appropriation.
Yeah.
And then we just get to the effective dates. It all takes effect on passage, except the two appropriations take effect on July 1st.
Okay. Question.
Can this in the big book?
Yeah.
And then just curious, the program manager, what's the length of that?
However they contract.
So
I mean,
it's
whatever
money's
they-
allocated and then they figure out the task force or advisory committee determines how long they need.
Yes, and with the department, I mean, the Department of Health would be providing legal assistance, so that would be part of it as well as figuring out how best to use those funds, the timing of those funds, because they have two pieces to their work.
The 220,000, is there a balance in the fund right now? Where did that number come from?
So I will let Noel speak to specifically what is in the fund. The idea here, originally, there was an appropriation of 370,000, and so this was kind of splitting that out into a piece coming from the increase in the EMS special fund. So diverting it away from specifically training in the first year, but still potentially wanting to have access to additional funds up to the total 370,000 if funds are available. Nolan can talk to you about, or if you want to hear from him from the side
Sure.
to get the
Go
question.
ahead.
For the record, Nolan Angles, Director of Fiscal Office. Yeah, it's just to the extent that there's unobligated balance in the fund, and traditionally there has been.
Oh, okay, so this would raise $300,000 extra each year,
Yes,
and then
150 would go to training, 150 would go to this thing, the training this. And after that, the year after, all 300 would go to training.
right, this is a 1 year,
right, okay.
And then
So-
to the extent that there's any extra money, because sometimes not all the money gets spent, because there's also now 450 doesn't all get out obligated. If there's extra money, it gives them permission to use it for the consultant if it's needed.
Okay, just the 370,000 seems kind of specific, so I'm just wondering where that came from.
I think that was the initial estimate of what they expected the financial need to be in supporting the working or the EMS advisory committee. And so in trying not to have that be general fund, this was looking at ways, that the bill was already increasing the amount into the EMS special fund for training. So looking at a way to kind of try to address issues in the EMS system within available resources
Got it. Okay.
or available increased resources.
Questions?
No, but I can make a motion if you want.
Be fine.
Well,
So, and the bill will, we can vote, I'm trying to figure out how to do this, but so we can vote on the bill and any amendment that we make would be held, our request would be held intact. Then I would, on the floor, request that this committee be relieved of the bill and it be moved to the Senate Committee on Government Operations with the proposal of our committee intact. So that's what we're intact or however, and I can do that today. But before we get there, I just want to look over at Drew, you're here, you want to offer a comment, please?
Yeah, there's just a couple of words that I don't know if we could change in section 4.
Okay, well, we'll get to section 4
Um,
on here. We'll go away here. I'll start, yeah. Section 4 is on page 4. And
it's on page 4. B, annually as part of the budget presentation, human services.
wait a minute, I
Section
can't hear you.
3.
oh,
Which one?
Section 3.
Oh, section 3, okay. Section 3, okay, go ahead.
Where it says, necessary to reimburse emergency medical service providers at a level equal to the Medicare basic life support for all emergencies. We just need to remove the basic life support because
Oh.
That would be the comparison.
Got it.
Advanced life support. So
So,
just at the Medicare rate.
at the
yeah,
Medicare.
so just take that. That makes sense. So we have one proposal amendment. And I was, as I looked through the bill and I was thinking about we did pass a bill earlier this year on mental health guidelines for emergency folks. And I'm not sure we need to make that connection because as it looks here, the task force will be doing a lot of work in many areas, and that certainly would be one of them. So we'll just. Is there anything else?
Can I ask a question about that? The thing that Drew just proposed. So the first paragraph says that the reimbursement shall be equal to the Medicare basic life support rate. And then the second one is the Medicare basic life support rate lower than the regular Medicare rate?
So there's a couple different rates. So the first section would be moving the rate that if we get reimbursed for treatment without transport to the Medicare BLS rate. And the way I read the second one is comparing all of the rates against Medicare. So Medicare pays a BLS rate, an ALS rate, and a specialty care rate based on the duty of the emergency. So we want them to compare against the appropriate rate. Look at it.
Should it be the appropriate Medicare rate for all emergency medical services, given that there are 3 different ones?
Yes, they're applicable.
Or applicable?
Applicable.
Yeah, applicable, that's a good.
Are you looking in the first paragraph?
In the second paragraph,
Yeah,
so instead of
both
just
of
saying the Medicare rate, saying the applicable
That's
Medicare
right.
rate, since there are
That's-
applicable, depending on how you pronounce it.
Applicable, appropriate,
Since there are 3 of them.
appropriately
Thanks.
applicable. Good catch.
Yeah.
Okay. So Jen, that would be line 8. Would read differently,
No, lines 11 and 12, 11 and 12.
only 11
Basically
and 12. And so line 8
So,
would
yes, so
remain the
line
same.
8 remains the same, because what this is saying is AHS will reimburse for treatment without transport in an amount equal to the Medicare basic life support rate. But when AHS is reporting as part of its budget presentation, the amount of additional funds that would be
Got it.
needed, that would be to bring all Medicaid EMS rates to the applicable Medicare rates.
Got it. Okay. Good. So we can have, we'll have a short amendment. This won't be a
Yes, you
strike
just
off.
have a little instance of it.
We'll have an instance of amendment. I'm happy to have us vote on that instance of amendment now, and then we can look at it and make sure it fits with what our thinking is. So it'll be on section 3 of the bill, just that one line. Okay. So now I would entertain a motion.
Make a motion to pass out favorably this bill H622 as passed by the House with a one incident of proposal of
Proposal
amendment.
amendment.
Yes.
One instance of amendment, yeah.
So we'll be getting some reports back on this too. That's great. Any discussion? Go ahead, clerk.
I was waiting for a second.
Second.
Yeah. Robert rules of order. Okay, so here's the vote. Senator Dooley, yes. Senator Hardy, yes. Senator Williams.
Yes.
Vice Chair Weeks.
Yes.
And Chair Lyons.
Yes.
Okay, 5-0-0.
Who would like to report, H 622 when it comes up? The little amendment that we have? I'm looking at you.
Reporting the bill or reporting?
Well, you'll be reporting our proposal amendment in the context of the bill.
I mean, I'm happy to do it.
I can do it.
Okay, and
I don't have to do
we'll
it
talk
today.
about it.
Keep it short and.
And so
Right.
keep it short and sweet,
Friday.
and because GovOps will be looking at it, hopefully hopefully we'll get out of GovOps and get to appropriations, so we can get on the
That's good
floor.
finance.
And it has to go to finance, it's gotta, it makes the rounds, so we wanna do, that's why I wanna do it quickly. So, and I'll ask for us to be relieved of it, and then GovOps will ask to be relieved of it, and send it out. Stay in touch. Okay.
Yeah.
Jim, you said you like, corrected one.
As amended.
Yes, I'm drafting.
Amendment
Good.
as passed by the House.
Either way, that's gonna go.
Okay, good work. So, Jen, we have a draft of what?
We have a new draft of 721. We have an amendment to 233.
Let's look at 721. Now we'll vote on. If we get there, and if we don't get there, we'll do it tomorrow. Okay, don't do it tomorrow, we'll do it the next day.
So 15 years. It is H 721, an act relating for expanding access to Medicaid and Dr. Dinosaur. And you had read. You had sent me off to make some revisions, which are highlighted. So no changes in sections 1 and 2. In section 3, you took out the increase up to age 21, and I thought it made it clearer what we were doing to actually put in here to just change the age from 21 to 19, even though the 19 itself is not a change in practice, but it's not currently specified in statute. So,
Interesting.
I think, this seems like the sort of most transparent way of doing it. So also in this section of statute, which is just the general Medicaid administration of program statute, I added the language you talked about, and thanks to Jessica for working on this with me. For purposes of any enhanced primary care reimbursement rate or conversion factor in the Medicaid program, a provider who provides primary care, reproductive, family planning, obstetrics, or gynecology services, or a combination of these, including a certified nurse midwife or an obstetrician gynecologist, may attest to being a primary care provider. Then we get to the section 4, the technical analysis. So we didn't make any changes about the Dr. Dinosaur age increase, eligibility age increase, because it already said all Vermont residents up to 26 years of age. So now it's just looking at those from 19 to 26 rather than those from 21 to 26. But it's all still embedded in here. And then I added a new one here. Any recommended modifications to the VFARM program in light of the Medicare Savings Program eligibility expansions set forth in section 7 of this act, as well as the potential for further expanding eligibility for the Medicare Savings Programs beyond the section 7 expansions. That sound like what you were thinking? Great. I did not make any changes specific to looking at those codes for OBGYNs, because I think that's really in here already. So if there's gonna be rate differentials between primary and specialty, an estimate of the costs of including comprehensive services provided by these provider types and others, under the primary care rate. I didn't really see a place to add, to expand on that, but if something is missing, we can certainly add it in. Then no changes in 5 or 6. Section 7 is the Medicare Savings programs. So, increase the Quimby income threshold to 150% rather than 190% of FPL, eliminate SLIMB, and increase QI income threshold to 200%. So this was that option A. No changes to the state plan amendments, just deleted the section repealing reform, so it would just say delete it there in the bill. Didn't want to renumber things and risk screwing things up. And then in the appropriations section, in fiscal year 25, we now need half of the amount, 600,000 in global commitment funds to implement the one piece of the Dr. D eligibility expansion you're doing. And of that amount, the amounts from state and federal funds are also cut in half. Then there's the finance stuff we did not change. I specified that the OBGYNs as primary care providers would be in section 3E. We may want to, and then that would take effect on passage. We may want to clean that up a little bit. I think it referred to it earlier draft of the language. I don't know if that is how that fits for those in the field, to have it effective on passage, but I wasn't sure what else
Sounds good to me.
made sense. And just deleting the reference to the repeal of the bee farm program, and then the Dr. D pieces, I specified the subsections those are in, still take effect from January 1st, 2026. And that's it.
Questions of Jen? Okay. I think that with the yellow as a draft, we can sort of, it's 1.2, but.
Yes, but I think it will be 1.3. I just want to do a little reflecting what is in 3E, so it's specific to OBGYNs. Which is a reproductive healthcare providers as primary care.
And this will definitely be going down the hallway to appropriations.
3.2.
1.3, yep, make it 1.3, because I'll do that.
And I will say, I'm going to keep the lines open on the final decision on which option. I think we're going to have to do that.
Are you ready for a motion?
Oh, yeah.
I would move draft 1.3. Page 721. For a recommendation.
And okay, on the vote, Senator Bulick is a yes, Senator Hardy,
Yes.
Senator Williams,
No,
Vice Chair Weeks.
No.
Chair Lyons.
Yes.
Oops. Small for 3, 2, 0.
So Senator Hardy will be the reporter on this, and we'll, and obviously I've been representing the bill in approps, and I'll continue to do that. So we're good. That's great. Jen, can we take a look at the amendment that you have on 233?
Yes.
I don't know whether we vote today or early tomorrow, we'll make that decision.
All right.
Jen, on the Dr. Dinosaur, I'm putting today's date for the amendment.
Yep. Yeah, and we'll just leave that.
Now I do need another one. We'll vote.
What are we moving to now?
We are moving to the amendment on 233. So many bills. Ooh. It's a long time. 233 is PBMs.
Thank you. I was like, this is just an amendment.
You had asked for an amendment, that was suggested by the Office of the Healthcare Advocate, Charles Becker, yesterday, sort of narrowing the information available to the Office of the Healthcare Advocate as it relates to the PBM licensure. So I have shown you markup here. Under the bill, as it came to you, the Office of the Healthcare Advocate had the right to receive or review copies of all materials provided to or reviewed by the Commissioner under this chapter in order to protect and promote patient and consumer rights. And some additional information has not changed about them not further disclosing anything confidential or proprietary, and that the information provided would not be subject to subpoena or subject to discovery or concealment evidence. As refined, it would say is that in order to protect, keeping that language, in order to protect and promote patients' and consumers' interests in accordance with the office's duties, under the Office of the Healthcare Advocate chapter, the Office of the Healthcare Advocate shall have the right to receive and review in full, including any exhibits, attachments, appendices, or other supplementary materials, all of the following. The preliminary report of any examination conducted by or on behalf of the Commissioner under this section, which is the one that allows the Commissioner of DFR to examine and audit books and records of PBMs. The pharmacy benefit manager's submissions or rebuttals to the report, if any. The final examination report adopted by the Commissioner and the Commissioner's order adopting the final examination report. And then I left in the same language about not further disclosing confidential or proprietary information. And then just specifying that it's information provided to the office pursuant to this subdivision 3 as subdivision B, that would not be subject to subpoena or discoverable. Ordinance. That's it.
Okay, so it lightens.
It narrows the scope of
It does.
the material.
Yeah, the language that's in the underlying bill is impressive. Committee questions for Jen or comments? All right. And there are elements of the bill, obviously, that are controversial for different entities out there, but overall, I think the bill is an improvement in helping to increase transparency and save some healthcare dollars for patients, the system itself. So I would entertain a motion that anyone wants to make.
Sure, I'll move H 233 as amended by,
So we move the amendment.
oh, the amendment,
Yeah, so we're
Okay.
moving.
I'll move.
I got a question.
We got a discussion to it, yeah.
The,
The draft.
Yes.
the Rutland Pharmacy Group was in here yesterday, they wanted to add some language to change that so they could, they were able to use generic.
Oh, that is a point.
We find it, I can actually, so,
Well, so much
We could have- For, right,
so, and then he could, and the independent pharmacies could pass on the savings
Savings.
to teachers and, you know, maybe we can help get some of that cost down.
good point. We
Not sure I
have,
know what that is.
all right, so we'll put a hold on the motion until we can look at that. And we'll have to do that tomorrow.
I have,
Oh,
you want me
yeah,
to read it? Says,
yeah, read it, but then we gotta
Okay.
make sure Jen had it. I thought Jen was here when we did that.
I remember this.
said, maximum allowable cost means
Oh, the
per,
definite help.
per unit drug product reimbursement amount excluding dispensing fees for a group of equivalent, and they said strike out, multi-source prescription drugs. Prescription drugs shall have the same meaning as 21 U.S.C. Section 320.
Is that posted?
Going with the federal.
No, actually, I just got it.
Can you
I
send
will
that
send
to
that,
Kiki
yes,
and
sir.
Jen
I will.
right now?
I have that.
You have it,
Okay.
I thought, yeah.
I was misunderstanding the description of the infection.
Okay,
So can we do this? It's at 12 o'clock. what we'll do is we'll call it a day and we'll come back to this. We're gonna vote tomorrow morning on H72 at 8:45, and then we'll move right on to this one. Then what we have scheduled for tomorrow is a full day on two bills, 879 and 766. So we can add this one in for a vote, whether when Jen is here with 766. We'll do that. That helps. Excellent.